The new Children's Tower, standing 13 giraffes tall, will allow us to care for more children and families in the kid-friendly environment that they deserve. More than a floor within an adult facility, every square inch of the tower was designed for kids with the input from families. It will be home to emergency, trauma care, inpatient units with all private rooms, additional operating rooms and imaging suites, and let's not forget playrooms and all the special places that make a children's hospital so unique. Friends, this incredible facility will be our community children's hospital, a place where the wonders of childhood will meet the wonders of modern medicine, a place where families will find comfort and hope during some of their hardest, most life-changing days, a place where passion and purpose will come together every day to improve the lives of children from our communities and beyond. For some, that will mean care closer to home, and for others, it will mean a visit to Richmond for a care team and facility that's worth the drive or flight. Our team is a family who believes every child has a right to wellness. And critical to this team includes our community pediatricians and providers. As I joined team members and hospital leaders to sign the final beam that will top our new children's hospital, I was also joined by our community pediatricians. And as we celebrated at a distance, we discussed what this new tower will mean to our patients. And I want you to know I reaffirmed our commitment to work together with them to ensure that our community and our children thrive. So many of you have been critical in making this dream a reality. But I have to give a special thank you to Dr. Michael Rao, who's been paramount in our advocacy for a place where children can have an opportunity to heal, recover, and celebrate their superpowers. Thank you, Dr. Rao. And to my good friend, the Children's Hospital Foundation Board Chairman, Coley Wortham, your passion has ensured a healthy future for all of our children. Thank you to our VCU Health and Chore leadership teams, and to our team members, community pediatricians, community partners like Ronald McDonald House Charities, and so many others who just bolster us every day, just like the steel supports this new facility.
I want to thank all of you who've worked so tirelessly to bring to life this vision of a world-class children's hospital for the Commonwealth. And with this topping out ceremony, this vision is truly becoming a reality. I want to thank VCU President Mike Rao, Chore CEO Elias Nujar, Chair of Pediatrics Karen Hendricks Munoz, and everyone at VCU and VCU Health who've gone all in to support this cause. Also, thank you, Secretary Carey, and thank you, Mayor Stoney, for your steadfast support and advocacy for the children we serve. We could not have made it this far without an enormous team united in this worthy cause. State legislators, community partners, remarkable leaders like Lauren Moore, Coley Wortham, the Chore Foundation, and an army of donors working together. You have played and will continue to play an absolutely essential role in this journey. In every endeavor of this sort, there are some who prefer to remain anonymous or won't accept any credit for starting us on this journey. Some are still with us, and a few have since passed from this earth. But please know this, I'm as grateful to them, we all are as grateful to them, as to all of you with us tonight. Without their unwavering determination, courage, and love, none of this would have happened. Bless them and bless you. When I came to VCU Health last fall, I made a personal commitment to do my part to advance this cause. Virginia Commonwealth University, VCU Health, and our respective boards are all in, and so am I. This topping out event is a milestone in our journey together. The city block that we are transforming as one team will serve as a powerful and enduring promise to Virginia's diverse communities, large and small, all of Virginia's families, that we are in this for the long haul. But what will bring this promise to life is not the building, no matter how wonderful it may be. It will be the thousands of healthcare team members, VCU health professionals, health sciences faculty, staff, and students, community volunteers, and hundreds of independent pediatric practices, practitioners, and referring health systems statewide who will make this amazing structure come to life. I look forward to joining all of you in person when we reach an even bigger milestone, not so far from now, the opening of the Wonder Tower in early 2023. Until then, thank you. Let's keep pushing together for Virginia and America's children.
Thank you all for joining us tonight. As I reflect on my career at CHOR, I think back to when I was a nurse in the Pediatric Intensive Care Unit more than 24 years ago. I always knew we provided the best care for our patients and families, but I also knew we needed to grow into a facility designed for kids from the ground up, yet bolstered by the strengths of our academic center. Today really is a dream come true for that young PICU nurse and for families in our community. Sure, the bright, colorful aesthetics and kid-sized furniture will set the stage for a more positive experience, but the real change comes in how we paint the future of pediatric healthcare. I've had the honor to help guide the planning of this new tower, but the biggest honor has been to walk this transformational journey alongside our families and community partners as they leave their mark on the new tower. Their involvement has been priceless. Even as we plan where medical equipment will be in a room, we worked with families to ensure ample space between clinical and family zones, ensuring kids and families have room to heal and feel safe. They've also helped us prioritize amenities that are instrumental in the healing process. Areas like playrooms and other special places that make a children's hospital so unique. This building has 72 private rooms, a level 1 pediatric trauma center, a helipad, and additional operating and imaging suites. It represents a culmination of years of work to do what's best for children in our community. An entire city block dedicated to all children, regardless of the balance of their bank account, the color of their skin, or their country of origin. It represents a facility that mirrors the incredible care our teams have provided for decades. It represents the grit and grace that goes into our work every day to ensure that children and families thrive. Tonight, we celebrate the topping out of this new facility, but the nurse in me celebrates this as a milestone of healing and hope.
Good evening, friends. This new facility will enhance our tripart mission of providing exceptional clinical care, promoting research discovery, and advancing innovative education. It also represents our continued mission to care for the full breadth of conditions for which children require care. The facility will support new initiatives and growth to recruit and retain top pediatric talent, innovative researchers, as well as the next generation of pediatric physicians and other providers. We have a long-standing commitment to children's care and innovation that dates back to our founding 100 years ago. In a few short years, we'll open a facility that advances the quality of care we've always provided at CHOR, a transformational facility that modernizes our comprehensive pediatric clinical programs, and we are doing this all in the context of the unprecedented challenges of the COVID-19 pandemic and enhanced focus on social justice. Importantly, we remain dedicated to the children of Richmond, Virginia, and beyond, no matter where their journey in health may take them. Through a focus on the rarest and even novel conditions affecting children, we have comprehensive teams and soon an outstanding facility that brings true excellence to any concern faced by a child, even including the most common. So just as our crews have been laying the foundation and firming up the structure to enable the topping out today, we have been working behind the scenes to increase access to care, recruit more specialists, improve collaborations across the community, and create new programs and deepen our expertise to transform pediatric care in our region, even outside of our walls. Programs like Virginia Children's Care Network, a clinically integrated network managed by community physicians and supported by CHOR, are cornerstones of all great children's hospitals. These collaborations, unified with our exceptional pediatric programs like the Children's Heart Center, critical care, neonatology, innovations in cancer research, and the Children's Health Research Institute, to name a few, will work in concert with this new facility to promote quality and safety work while also advancing health discovery, education, and care outcomes, ensuring that we're giving all children the best shot at a healthy future. The work doesn't stop here. We are dedicated to continuing to evolve to meet the needs of our children within our community, our state, and our nation.
Thank you all for joining us tonight. Since this new children's tower is being built by and for our community, I'd like for you to hear from our kids, our families and team members, and our community pediatricians as they leave their mark and we raise the final steel beam.
Our nurses are the best at putting our patients first, and now we'll have a new tower that does the same.
One of the playrooms in the hospital will be a memorial room in his honor, and we really had such a great experience at Shore, and with all his care, the doctors, his nurses, and it just really has a special place in our heart. This hospital is where he lived his entire life, and just to be able to give back and know that there's a place in his honor for children to be and to play and to be happy and be normal while they're here, that's really something that means a lot to us.
I think it would be wonderful to have this in the Children's Hospital for our community. I think several things will be really advantageous of having full-scale specialists with a depth of experience and expertise to bring in lots of support for our children and families. One thing that we do see is sometimes you need specialized care that families have to travel for. So having all of that access right here in Richmond in the Children's Hospital will be wonderful for our families.
I'm a native of Jackson Ward and did my training in pediatrics here at MCV VCU, and it's great to see this for our patients as well as to help support our community.
Well, being here for 30 years and also being a 1980 graduate of MCV, I think this combines good health care and organization for our patients because we have outreaches to all the different programs, especially for our chronically ill children. And I think this is going to be a good success because it's in the city. It's in the center of the city, and I think we'll see growth in this area.
I just think having a place at the tertiary care center downtown where all the experts are, having a central location, and getting involvement from the community, I think it'll improve communication and just overall, I think just more efficient care for the family.
It's going to be the inpatient hospital for sick children. This is the outpatient, so that's going to be the inpatient. I'm really excited for it. Yeah. This whole place is going to be about children, yeah, and they can focus on their needs.
So amazing. It's just a dream come true. I think it's going to mean all of our services in one location that's convenient for everybody and kid-centric. It's going to be amazing.